The Self-Care Learning and Discovery series is back, and it's bigger and bolder than ever. This is the premier self-care event of the year, bringing together self-care enthusiasts of all backgrounds and disciplines from around the world. The World Health Organization defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. We also know that self-care means different things to different people. What does self-care mean to you? You'll have ample opportunity to reflect on this question during the Discovery series, with more than 20 interactive virtual sessions organized by self-care experts worldwide. The Discovery series will elevate cutting-edge research, programming, and advocacy insights across a wide variety of self-care topics, and we encourage you to attend as many sessions as possible, especially on topics that may be new to you. The Self-Care Learning and Discovery series, a core activity of the Self-Care Trailblazer Group, is organized by the White Ribbon Alliance in partnership with co-sponsor organizations and esteemed steering committee members. We also want to thank all our session organizers and presenters who have voluntarily dedicated their time to curate this event with us. We are pleased to share that every session will offer live, simultaneous interpretation in French, Spanish, and English. To access the interpretation, simply navigate to your meeting controls located at the bottom of your screen. Click on the globe icon labeled Interpretation and select the language you'd like to hear. Joining from your phone, tap on the ellipses to find the interpretation feature and then select your language. Please note, you can switch languages at any time throughout the presentation. The session is now about to begin. Don't forget, whether you're working to influence policies or programs, advance universal health coverage, or improve your own self-care, we hope that you will take the learnings from today's discussion and apply it to your own work. To that end, we invite you to continue the conversation and take action with us by becoming a member of the Self-Care Trailblazer Group. So get curious, jump in, and share your ideas and insights with us. We look forward to advancing self-care together.
Hello, I hope you can hear me now.
Yes, we can hear you.
Apologies for that. Good morning, everyone. Good afternoon, good evening, wherever you are calling in from the world. On behalf of the Self-Care Trailblazers Group and the organizers of the Self-Care Learning and Discovery series, I'd like to welcome you to this forum and hope that you all have a really productive session. My name is Sarah Onyango, and I am the project director for the Self-Care Trailblazers Group. The group was created 5 years ago in 2018 and is dedicated to expanding self-care as an effective practice for advancing access to sexual and reproductive health and achieving universal health coverage. This series is an opportunity for us to share some of the lessons and learnings we have had through the years, and we'll be listening to various sessions throughout the week. And so to get us started, I'd like to hand over to my colleague, Kim Wipke, who's the Chief of Staff for the White Ribbon Alliance, and who's also the Chief Architect of this Self-Care Learning and Discovery series. And Kim will lead us through the rest of the session. Welcome, Kim.
Hi, thank you so much, Sarah, for that introduction. And I was just introducing myself in the chat and encourage all of you on the call to introduce yourselves in the chat box as well. If you could advance to the next slide, please, that would be great. Thank you. Okay, so Sarah, I think you are overall moderator for today, but I can just recap the agenda for everyone. We're doing a welcome, setting the stage. I'll say a bit about the Self-Care Learning and Discovery series and how you can continue to be engaged throughout the next 3 weeks. We will have a nice interactive exercise where we will ask all of you to reflect on major milestones in the past few years on the self-care journey. We want to hear from you. We have a fabulous keynote speaker who will then reflect forward on the future of self-care and the impact that it has. We'll have time for a Q&A, and then we will adjourn so that we can all get prepared to attend the following sessions. All right, next slide, please. Next slide, please. Okay, there I am. Thank you again. Thank you so much for the introduction, Sarah. Next slide, please. Okay, so it's time to discover self-care finally. I am so excited that all of you are here with us today as we launch this Self-Care Learning and Discovery series. I think, as you know, at this point, it's a dynamic forum where we're going to exchange knowledge and evidence. We will elevate self-care solutions and really make new connections, both amongst each other and with new and different self-care topics. It's really been such an honor to work with the Self-Care Trailblazer Group Secretariat, the steering committee, and all of the session organizers and presenters from all over the world to both design this program and to deliver it. And before we jump in, I want to say a little bit more about how you can participate in this mini conference. Next slide, please. And apologies, this is really small, so hopefully you can get a snapshot and actually read the text here. But wanted to point out that the Self-Care Learning and Discovery series has more than 20 virtual sessions that are spread out over the course of the next 3 weeks. And as you'll see, Wednesdays and Thursdays are our dedicated conference days. There will be 2 concurrent sessions that take place every Wednesday and Thursday during our Discovery series. That means that there will be 2 sessions held during each time slot for a total of 4 sessions on one of our conference days. And hopefully you can see here that we have truly an amazing lineup of sessions. They promise to keep you both engaged and curious. There are interactive formats. We have skills building workshops. We have moderated panel discussions. We have knowledge cafes. We have fishbowl discussions and so much more. I think actually one of the hardest parts will be figuring out which sessions you want to attend because so many of them are so interesting and so compelling. All right, next slide, please. So on that note, I did just want to call attention to the fact that the Self-Care Learning and Discovery series is not like other conferences in that it does not have an overall registration for the conference. Instead, we're asking you to go to our conference webpage and to register separately for each individual session that you wish to attend. So please visit our conference webpage. You can see the URL at the bottom and register for each individual session that you wish to attend. And as I mentioned earlier, we have 2 events happening immediately after this opening plenary today. You can see the headline for one of them here. This is just a screenshot, but please go to our webpage and register to attend an event following this session. And then I did just want to remind that this series is free and open to the public. We will have live simultaneous interpretation available in English, French, and Spanish at every session. For those of you who are just joining now and might have missed the introductory video, please click on that interpretations globe icon at the bottom of your screen, and then select the language that you would like to hear the session delivered in, either English, French, or Spanish. All right, and then lastly, we really hope that you'll help us spread the word about this series. We want to reach as many new and existing stakeholders in self-care as possible. So help us spread the word on social media with your friends, your family. Everyone is welcome to this conversation. So thank you so much for joining us for the opening plenary. We look forward to seeing you over the course of the next several weeks. And at this point, I think I'm handing it back to, yes, Liz, to take us through the self-care timeline exercise. Thanks so much.
Yeah, thank you very much, Kim, and apologies for the breakout shortly. I'm having some IT issues, but would like to take this opportunity to welcome Liz Bear. Liz is a consultant with the Self-Care Trailblazer Group's Global Advocacy and Communications Working Group, and has been also a key instrumental in putting together this mini conference. So Liz will take us through a small exercise. Over to you, Liz.
Hi, thanks, Sarah. And thank you, Kim, for the rundown of what we can expect over these next couple of weeks. I'm pretty excited to see these sessions coming together. We are really thrilled that you're all here for this exciting opening plenary and want to take some time before we spend the next couple weeks looking forward at self-care. We want to take a few minutes and look backwards at self-care. So next slide, please, Molly. We are going to together look at identifying some key milestones in the timeline of self-care. So as you can see here, we have sort of pre-identified a few really big ones. And this is definitely not comprehensive, but we'll have a chance to make it comprehensive in a couple of minutes. So from 2018, the Self-Care Trailblazer Group was initiated and has been working at the global, regional, and country levels since then. In 2019, the WHO released the Consolidated Guideline on Self-Care Interventions for Health, for Sexual and Reproductive Health and Rights, which was a huge milestone, I'm sure, for all of us, and has been instrumental in adapting self-care policies at the local level. In 2020, we saw COVID-19 self-testing hit the scene. We know others have been self-testing for other health issues for a while, but this is one that really took so much of the world by storm. And then in 2021, our friends at the WHO again released the WHO guideline on self-care interventions for health and well-being. So an updated guideline that has again been really instrumental in the implementation of self-care at the country level. And then just this past year in 2022, we saw the classification of self-care interventions for health come out. And there have been so many other key milestones for self-care. So next slide, please, Molly. In these last several years. But we know that self-care is older than 2018, and we know that so much has happened beyond those large global milestones. So we would like to take a minute and or a few minutes, I should say, and ask you all to help us populate a really simple timeline of key self-care milestones. So we're going to do that in Jamboard. And Molly, if you want to stop sharing, I'll share my screen. For those who are not familiar with Jamboard, Molly has put a link in the chat box, and I'm going to give a very quick tutorial of how to use it. So you can see, oh my goodness, my own picture is now over my screen. There we go. So the way that Jamboard works is that we all have access to this, and you can add key milestones that you want to highlight. And those can be milestones from the global level, from your country, from your region, from your district or your state, wherever you're working. We would love to hear about key milestones. So the way you do that is by clicking on this sticky note icon here on the left. You click on that and a sticky note will pop up. You can type in whatever you want. So if you could start by including the year, please, and then include whatever the milestone is, hit save, and then you can move it wherever you want it to be. So we would love to see what you have. There are 2 slides here. You can toggle between them at the top of your screen. The first slide starts in 2010. If you have something from earlier than 2010, that's fine. Feel free to add it here. And then the second slide is just these last few years, because we know there have been so many really important self-care achievements in just these last couple of years. So take a minute and add some sticky notes. Please, if you can, include the year. If you can include the month, that's wonderful. And we'll take a minute to do that, and then we'll look over some of them together. If you are not able to use the Jamboard, or if it's not working for you, you can also put your self-care milestone, in the chat box, and one of the session organizers will help move that into the Jamboard for you. So let's take a minute and identify some key milestones from your work in self-care. And if you can, please include the year, that would be wonderful. Seeing a few come in on this first slide. Definitely feel free to add them on both slides. If we run out of space, we can create another slide. Excuse me. And again, if you're having trouble with the Jamboard, feel free to put your answer in the chat box, and one of the session organizers will move it over for you. Seeing some great milestones come in. We'd love to see some more from where you're all working. Fantastic. I'm seeing a lot of milestones from 2023. I'm going to toggle back over here. Some really great ones from 2010 on. And these can be research milestones, they can be policy milestones, they can be programmatic milestones, anything that has been an important touch point in your work for self-care. And feel free to write these in English, French, or Spanish. We will use DeepL if we need to understand in another language. I'm going to take a couple more minutes, maybe 2 more minutes, to put in your last milestones. And a reminder that you can put in the chat if the Jamboard function isn't working for you. We'd be happy to copy over any milestones that you'd like to add to the Jamboard. So let's take a final wrap up of milestones. And as you input your very last ones, I'm going to do a quick scan of what we have. So we see some really great milestones here from 2015. We're seeing DMPA self-injection initially improved in 37 countries. That was definitely a key milestone for kickstarting a lot of self-care interest around the world. We saw DMPASC first introduced in Nigeria's private sector, also in early 2015. In 2017, there was the Next Generation Contraceptive Injectables meeting in Senegal, which kickstarted so much interest in DMPASC as a self-care intervention and in jumpstarting policy efforts and advocacy efforts using the evidence that had been generated by researchers already. In 2020, we saw the COVID-19 pandemic accelerate the adoption of self-care. That was definitely a huge milestone for so many reasons. I will move this one over to the next, whoops, well, that might not move. But in 2023, we saw the She Cares project implemented in humanitarian settings, which was really important. And we know self-care is so critical in so many humanitarian settings. So thank you for adding that. Back to 2020, we saw self-care guidelines for SRH in the Pacific. We're seeing that adaptation at the regional and more local levels of self-care guidelines. In 2021, we had the first ever self-care learning and discovery series, which of course was such a success that we revived it this year. And we saw the development of the supporting sexual and reproductive self-care through social and behavior change conceptual framework from Breakthrough Action. It's been so important for that implementation and programming around self-care. 2022, we saw self-care featured as a featured track at the ICFP conference, the International Conference on Family Planning, which was a huge milestone and really elevated self-care within the global family planning community. We saw the WHO recommendations on self-management of medical abortion released in 2022, which was hugely important as well. November 2022, we saw technical consultation on galvanizing momentum for SRH self-care in humanitarian settings, absolutely critical. And then we've got these milestones from this year, including publication of the State of Self-Care report, which of course you can find on the Self-Care Trailblazer website if you haven't read it yet. We saw the Ministry of Health in Uganda finalize the self-care guidelines, which is fantastic. The global call to action for SRH self-care in humanitarian and fragile settings. And we saw the She Cares project, as mentioned earlier, also be implemented in a humanitarian setting, which is fantastic. So thank you all for sharing these. If anything's left in the chat, we'll copy those over, and please feel free to keep adding milestones if something occurs to you. That Jamboard link will be good for the rest of today, and we'd love to see what else you have to share. And with that, I will hand it back over to you, Sarah. If I can stop sharing. There we go.
Thank you. Thank you so much, Liz, for taking us through that session. I think it's really exciting to see the progress we've made in terms of advancing self-care since as early as 2015 or even earlier. So very exciting and inspiring pieces of work that are in there. Please, as Liz has said, continue to add any milestones throughout the session, and we'll be able to consolidate these at the end of this meeting. It now gives me great pleasure to introduce our keynote speaker for today. Our keynote speaker is somebody with first-hand experience on the importance of promoting self-care. Dr. Guillermo Ortiz is a senior medical advisor with IPAS. He's an obstetrician gynecologist with a specialty in high-risk obstetrics, and currently serves as a senior medical advisor at IPAS on quality of care. He was previously a professor in the Faculty of Medicine and the head of medical residences in gynecology and obstetrics at the University of El Salvador. Dr. Ortiz was also the chief of several divisions at the National Women's Hospital in El Salvador. He's currently a member of the board of directors of the Latin American Consortium Against Unsafe Abortion, and previously served as a member of the board of directors of the Global Doctors for Choice. Dr. Ortiz completed his medical education and training at the University of El Salvador and King Drew Medical Center of California. He's a member of the Central American Research Committee. And in addition to his medical degrees, Dr. Ortiz holds a master's in hospital management from the University of El Salvador, along with additional training in program management and development, patient quality and safety, and epidemiology. We're really excited to have Dr. Ortiz be our keynote speaker today. So welcome, Dr. Ortiz. You have 10 minutes. Thank you.
Thank you very much for the introduction, Sarah, and thank you very much for the opportunity. I will start just saying that, can you imagine how is work in El Salvador, in a highly restricted country with its zero access for legal abortion? So that is why I'm going to share this this brief story with you. Some years ago, back in the 90s, I was the head of the emergency unit in the largest hospital for women's care in El Salvador. And I recall that a seriously very ill pregnant woman came to us, was brought to us. And I recall that her sister told me that Sylvia, that was her name, she was a single mother with 3 children, which she couldn't hardly support them with her salary as a domestic employee. She could not continue her pregnancy, that was very clear. And after knocking on several doors and the health system and asking for help to this indifferent health system, the only help she found was an umbrella road. This was her alternative. Unfortunately, we were not able to hear from her the story. I don't think it was even necessary. I recall very well that she died after hours later in the operation room. This is one of the many cases that I had to see and feel in El Salvador time ago. But then, fortunately, after a while, such devastating cases became less frequent, very real. And it happened even when abortion was and is still prohibited in the country. But it was the same woman who discovered that a medication that is used for gastric ulcers can be used to induce abortion. It was the woman who brought it and managed it themselves. Thus began a new era. Complication and death from unsafe abortion seem to be disappearing. I will not deny that as a health provider, we were surprised in how self-administered medication could save someone's life, even more so that this happened without any help of us. The paradigm of do not self-medicate promoted by the Hippocratic school and that was maintained for 1,000 years had been broken. Self-use had arrived to stay. It is a health personnel who have come with several steps behind, so we came late. Why have we taken so long? We have arrived late. Yes, we did, but we still have time to join this new era of the reproductive health. It's time to recognize that provider-centered public health never improve abortion, morbidity, and mortality rates. It is the time for women. It is time for them to be the fundamental pillar of the reproductive health policies of countries. It's time for them to be the ones who participate directly on them health. It is because at the end is their health and their life is at stake. That is why IPA since a couple of years started a work on self-use medication. And for instance, in 2018, IPA Central America created an informational video about how to use misoprostol by themselves, how to use these pills for a successful abortion. And so far, we have been reached more than 5 million persons in the region. Also, we create a CIPAS package of publication called Medical Induced Abortion before, during, and after the abortion. So this is aimed to provide some help to migrants, to those women that are trying to reach the US and in the way across Mexico. We have many other documents that have been created. We have a chatbot that the name is the Companion, which is something also to be there 24/7. And it's just in Latin America also, we have some very good resources in Kenya, DRC, Nurse Nisa, maybe you hear about. And after wrapping up my participation, I will say as a health worker that we arrived late. Yes, but still on time. We need to accompany women on their decision, also to encourage others to do it. It is time to respect women and their decision and how and where they want to have their abortion, because the time gave them the reason. And finally, without a doubt, time has been brought to women and self-use. What better example than the one that I shared at the beginning? When women found a new drug medication and decided to take control of themselves, they were able to produce a significant change in mortality and morbidity due to unsafe abortion. I'm wondering what would be happen to Sylvia if instead an umbrella road she had found misoprostol at that time. Thank you very much for the opportunity, and thank you very much for working in this new era of self-care.
Thank you very much, Dr. Ortiz, for that very inspiring talk. I think you've really shared some of your personal experiences in the field, working with women, saving lives, and even the stories of how women are able to make decisions, how women are able to contribute to managing their own health. I think that's really important for us as we have conversations around self-care. It's important for us to recognize the importance of empowering women to be in control of their own health. We also appreciate the work that you're doing as IPAS in Latin America to advance self-managed abortion, and we hope to learn from your experiences as well. So we have the floor open to the participants. If you have any questions you'd like to share with Dr. Ortiz, this is the time to do so. And Liz, could I just ask you to help me out if there are any questions I haven't been able to put them to, I'm not able to see them right now. And just at least the first question, and then I can go back. So we do have some positive comments, a strong message coming from a health provider, which is really amplifying what I've said. Liz mentions that you've shared your personal perspectives as a physician on self-managed abortion. We know that health workers are a very important constituency for self-care. How can self-care advocates make the case to health workers who might be hesitant? And how did your perspective change? How have you shared that with other physicians? So I think a common question we get, health care providers are key to this process, but they can be a challenge as well. So that's a question from Liz.
Yeah, thank you. And that is a good question because, as I said, the medical school, this Hippocratic oath and this sense about we need to provide the care. I mean, it's just how to break down that paradigm. I think it's with evidence-based, scientific evidence-based. We need to create every time more and more scientific evidence-based information. We have it. I mean, WHO includes self-care in the latest guidelines for abortion care, and also CIPAS and media organizations like FIGO are encouraged them to support the self-use with evidence, scientific evidence. I mean, it's just to share with them and trying to let them have this information on hands is about that, and also the numbers are very clear. I mean, the story that I told before at the beginning, it was very clear for me. It's not. I mean, it's because also it's about breaking down this power relation between the health providers, mostly the physicians. We used to have this, we have the power of the knowledge. We have this is to find to break down that situation.
Thank you very much, Dr. Oh, I hope I didn't interrupt. Thank you very much for that response, Dr. Ortiz. And we have another question. Look, if you look forward to the next 5 or 10 years in global health, what self-care interventions are you most excited about?
I think it will be not just in sexual and reproductive health field, but of course in contraception. We still have a lot to work in that area. In some points, but also in some other areas. I think we need to work on that and another branch of the medicine. But for sure, I think in comparing all the fields, I think the sexual and reproductive health field will be on the top of the list of self-care, because we will be having more evidence, scientific evidence there to promote, to increase the richness of this initiative in this new era that we are having right now.
Thank you very much for that. And I have another question. We'd like to hear from you. What are some of the most pressing challenges for successful integration of self-care into the health system? You can give in the example of El Salvador or from the region.
Yes, I mean, I have many examples, but the one that comes to my mind right now is a case of a young girl that was desperately trying to look for to have the misoprostol to have an abortion. At that time, it was not much opportunity to have misoprostol because it was very expensive. It was, I recall very well, it was almost $120 for pills. So it was very expensive for some women. So I recall very well that woman that came in very bad situation. She she took some pills, but it was a fake pills. She had the pills in the black market, and actually it was poison. It was a poison, and it was very very hard to see the father and her mother crying at, at the bed when she was dead, and blaming each other about why they didn't help her when she needed, and now she was dead at that time. It was very hard to see, and it was something that it was clearly prevented 100%. We can't prevent that 100%. And just to give them to give the women the power to do it, with or without us. I think that's the point.
Yeah, thank you very much, Dr. Ortiz. And just checking back with the audience if we have any last-minute questions to Dr. Ortiz. If not, I'd really like to thank you for this inspiring keynote address at our opening session. I think you have really emphasized one of the key goals we have for self-care, to improve access to those who are marginalized or, because of stigma or other issues. And I think your examples with how self-care can help alleviate these challenges is very practical and real, and one of the areas that we are working on to advance self-care globally. So thank you for those inspirations. We hope as listeners that you are inspired and motivated, and that you'll be excited to join the rest of our sessions to discuss this further. So if you do have questions as we finalize, just put them in the chat, and maybe Dr. Ortiz can come back to you through the chat. So as we wrap up this opening plenary, we'd love to hear what you are most excited about experiencing during the upcoming session. So what are you looking forward to? We'd like to see that, and just make sure that we can guide you to the right sessions if and when needed. So I'd like to invite Liz to drop in a link for us. She has it there. So Liz has put that link that we'd like you to connect to. It's a Mentimeter link. And in that word cloud, we'd like you to just share 1 or 2 words highlighting what you're most excited about and looking forward to hearing during the week. So kindly go to the Mentimeter and just share your excitement in 1 or 2 words. I hope we've all been able to access the Mentimeter. We'll just give you a few minutes to do that. Interesting. Connections are so important. A lot of the work that we need to do to advance self-care needs connections, collaborations, partnerships, as has even been clearly alluded to. Advocacy opportunities, that's exciting. Self-managed abortion, that's coming during the week as well. Lessons from humanitarian settings. It's becoming, humanitarian challenges are commonplace now, and self-care can be a key part of this. I see self-care and climate as a new one, self-care for activists, innovative, exhilarating. So a lot of excitement overall. SBC is also featured there. Any more connections seems to be growing, so that's an important thing. We need to work together on this. Yeah, keep them coming. Interesting. Yeah, partnerships, especially with the private sector. Yes, we do know the importance of the private sector in driving self-care. So thank you for that. Oh, some Francophone. So about Mont Autogère, and I know that is the wrong pronunciation. So hopefully it's been translated. Oh, thank you. Both read in French, yes. Accelerating, and we're really excited to have the Francophone speakers in this platform, so feel free to keep putting the French verbs as well. I think connections really does come out as important. It keeps coming up. Thank you. I think we have a good feel from you about what you're most excited about during this conference. You want to hear more about what's happening in self-care in general, around new areas, around areas such as self-managed abortion. We're interested in partnerships with both with the private sector. We're interested in self-care and climate. And we're just excited to hear what's happening everywhere, what's in the horizon, what's happening in Latin America. And I think these all of these issues will be featured throughout the week. So I think that brings us towards the end of our session today. And we're looking forward to your participation in the series that will be starting shortly after this. So please remember to visit our series website to look through and sign up for other sessions. So if you haven't signed up yet, Liz will drop the link and you can just go right in and sign up for the sessions. I'd like to highlight 2 sessions that will be starting today in about 30 minutes time. They're starting at I believe it's 2 p.m. GMT, 10 a.m. East US time. So the first session will be looking at knowledge sharing between Latin America and the US to develop a person-centered, community and rights-based digital abortion self-care solution. This definitely ties in very well with the remarks we just got from Dr. Ortiz. So please do take the opportunity to hear more about knowledge sharing between Latin America and the US. And then the second session that we have today, also starting at the same time at 10 a.m. EST, at 2 p.m. GMT, we'll be looking at the missing ingredient in self-care. This is a behavior change presentation, and it's a case study on adaptive behavioral programming. So 2 key exciting sessions starting shortly. Please feel free to join. And also feel free to register and join sessions throughout the next 3 weeks. So thank you again all for your wonderful engagement today. We hope you're leaving this open plenary with a lot of inspiration and motivation and energized. And we look forward to seeing you at all the SCLADs and also encourage you to share the SCLAD's invitation with others, your colleagues, your partners, and others that you are working with so that they can all learn from this platform. Thank you and have a good day.
Thank you.
Thank you.
Thank you, everyone.
Thank you.